people ask us what we do. And I always say chaplains bring the calm. We're physicians of the soul. We have those difficult conversations that nobody wants to have. We sit in difficult situations, and it's humbling. It's a very humbling experience. We experience our patients when they're at their lowest, when they're vulnerable, when, sometimes they don't see hope.
Well, I remember when it was COVID and we all were scared, the nurses and myself, as everyone. And Denise came up here every day and she prayed for us. We all were separate and had a little 6 feet. And when I tell you, we look forward to seeing her, and it made a difference every day. And I just thank her for it because, without them prayers, I don't even know if I could have made it,
I always ask, how's the day going? And if they are not very excited, I will just remind them, just letting you know that the chaplains are here for you. And that gives a connection. And also to have a chaplain, not just in the religious role, but as a friend. And we are here as a friend to listen to you, to talk to you, and to check on you and support you. And of course, it is opening the doors for them to come up to us if there is any need.
During this time, it's been difficult for staff, and I think the presence of chaplaincy and the support services for mental health is really important, especially during this time for us. And so Andreas is the chaplain for Nelson 5, and he has been phenomenal. He's given so much to Nelson 5. He deserves so much praise for the great work and the presence that he's committed to the MPC. We have really gone through war together this year, and he did not hesitate to put on his N95 and step onto the BioMode unit to provide support to us, our staff, colleagues, and patients.
Josh, our chaplain, has really been embedded with us for years. He does spirituality groups with the patients. The patients can ask to see him, and they meet privately. But he's been such a support to our staff as well on just so many occasions. Having this calming presence on the floor has really been helpful. Not just coming when there's an emergency, when there's a situation where we've gone beyond what we think we can handle mentally ourselves, when we see something really terrible, but just to be there every day for people.
I think it's important for me as a staff chaplain to engage people, not just in times where I know they're going through a crisis, but if I see you every day, just to be an all-round person for them so that they feel safe.
There was one time that we had these bracelets made that you could wear, the flexible bracelets, and they said, listen, talk, listen. And that was our mantra for a long time, so that we would just kind of friendly reminder to ourselves that 75% listening was really the goal, and that's what we try to do. And the chaplain visits are not meant to be long, and they're not counseling visits. They're 5 to 10 minutes. They're short interactions, and it's meant to be a time where you connect and you feel better, and then you can go to work feeling better. And we all know that feeling of having someone care about us enough to ask, and then we just feel lighter as a result of that. And I just think chaplains are so vital in that way of making sure people are feeling cared for overall.